Welcome to this explainer. Today, we're cracking open a fascinating yet deeply concerning clinical case file on one of the globe's most insidious pathogens. I'm talking about Lassa fever. We're going to dive into this like medical detectives, tracking this deadly viral hemorrhagic fever's movements, understanding its methods, and looking closely at exactly how modern science is fighting back.
Here is what we're looking at today. First, discovery and virus classification. Second, the rodent reservoir. Third, transmission and human spread. Fourth, symptoms and severe complications. Fifth, diagnosis and ribavirin treatment. And finally, number 6, prevention and vaccine development. All right, let's jump right in with Section 1, discovery and virus classification. The clock on this investigation actually starts back in 1969. The virus was first documented in the town of Lassa, Nigeria, following the tragic deaths of 2 missionary nurses. Now, for decades, it was mostly treated as a localized threat. But by 2009, that changed. Exported cases started popping up in places like Mali and the United Kingdom, brought over by returning travelers. Realizing its epidemic potential and, honestly, our massive lack of medical countermeasures, the World Health Organization officially designated it a priority pathogen in 2018. That puts it right alongside some of the absolute most dangerous diseases on the planet. So what exactly is our prime suspect here? The Lassa virus is a zoonotic, single-stranded RNA virus that belongs to the Aranaviridae family. And if you're wondering what zoonotic means, it basically just means the virus originates in animals before making that terrifying leap over to humans. It's an animal-borne pathogen. So to really understand how it spreads, we have to track down the animal carrying it. Which brings us to Section 2, the rodent reservoir. The virus is heavily concentrated in West Africa. It's highly endemic in Nigeria, Sierra Leone, Guinea, and Liberia. Because the animal host absolutely thrives in this environment, this endemic zone covers a massive population. We are talking about an estimated 300 million people living at constant risk of exposure. That is a staggering number. And here is the accomplice. The primary host is the multi-mammoth rot, scientifically known as Mastomys natalensis. What makes this specific rodent such a formidable reservoir is its own immunity. Once infected, the rat doesn't get sick at all. It basically just becomes a lifelong factory for the virus, persistently shedding it in its urine and droppings directly into the human environment while it scavenges around for leftover food. Let's look at how that actually happens in Section 3, transmission and human spread. The jump from rodent to human is incredibly varied. Most commonly, it happens through ingestion, meaning someone eats food or drinks water that's been contaminated with rat droppings. But there are also these hidden, almost invisible dangers. Let's say infected rodent urine has dried on the floor. Doing something as completely mundane as sweeping your house can kick up tiny aerosolized particles of that waste, which you then breathe right into your lungs. It can also enter your body through open cuts. Or, because these rats are sometimes consumed as a local food source, infection can easily happen during their capture and preparation. Now, once a human is infected, the entire dynamic shifts. Casual skin-to-skin contact, like hugging or shaking hands, won't spread the virus. But human-to-human transmission absolutely does happen through direct contact with infected blood, tissue, or bodily fluids. This makes nosocomial, or hospital-based spread, a massive, massive danger. Without the right personal protective equipment, or if medical tools like needles are reused, healthcare workers and other patients become highly vulnerable. So what happens when the virus breaks through? Section 4, symptoms and severe complications. The clinical reality of Lassa is really a tale of two extremes. For about 80% of infections, cases are mild or even entirely asymptomatic. A person might have a slight fever or feel a bit weak, and the infection just goes largely unnoticed and undiagnosed. But for the remaining 20%, the disease progresses into a severe, life-threatening multisystem illness. We're talking repeated vomiting, facial swelling, fluid filling the lungs, and hemorrhaging from the gums, eyes, or nose, which eventually leads to complete multi-organ failure. And there's one incredibly devastating clinical hallmark of Lassa fever, its neurological impact. Roughly 33%, so 1 in 3 patients, experiences some degree of deafness. And here's the crazy part. This doesn't just happen in those severe cases. Hearing loss can hit individuals who only had mild symptoms. Tragically, for a lot of these patients, the deafness is entirely permanent. We also have to highlight the catastrophic risks for pregnant women. The disease becomes exceptionally severe late in pregnancy. If a woman contracts Lassa fever during her 3rd trimester, Maternal death and fetal loss occur in more than 80% of cases. It is just a profoundly aggressive pathogen for this demographic.
Facing all of this, how do doctors fight back? Section 5, Diagnosis and Ribavirin Treatment.
Early on, Lassa poses a massive diagnostic riddle for frontline healthcare workers because the early symptoms are so gradual and nonspecific, literally starting with just a fever and malaise. It perfectly mimics other endemic diseases. It looks like malaria, it looks like typhoid, it even looks like Ebola.
You simply cannot diagnose Lassa by sight alone. Clinical guesswork just doesn't cut it here. To actually confirm the infection, you strictly need specialized laboratory testing. That means using enzyme-linked immunosorbent assays or ELISA tests to detect antibodies and antigens, or using RT-PCR tests to detect the viral RNA itself. The big problem? These high-containment diagnostics are complex and expensive, making them incredibly scarce in the rural, low-resource settings where the outbreaks are actually happening.
If you can get a diagnosis, what's the treatment plan? Well, the cornerstone of treatment is an antiviral drug called ribavirin. It definitely improves survival rates, but here's the catch. It is most effective when administered very, very early in the illness. And ribavirin alone isn't a silver bullet. It has to be paired with aggressive supportive care. Patients usually need intense fluid rehydration, cardiovascular support, and renal support for acute kidney injury, just to keep their organs functioning while their body fights off the virus. Since we don't have a perfect cure, we look to the future. Section 6, Prevention and Vaccine Development.
Until a vaccine arrives, our main defense is breaking the chain of transmission right at the community level. Look, completely eradicating the mastomys rat across Africa is impossible, so prevention is all about keeping them away from humans. We're talking about storing food in rodent-proof containers, keeping households rigorously clean, safely trapping rodents, and critically, implementing strict barrier nursing in local clinics, using physical separation and protective gear to stop those human-to-human outbreaks dead in their tracks.
The ultimate goal, of course, is a vaccine. Now, currently, there are absolutely no FDA-approved vaccines or preventative therapeutics available for human use. But the global health community is on it. Organizations like CPI and IAVI are urgently pushing promising vaccine candidates through phase 1 and 2 clinical trials right now. One of the standout candidates is the RVSV Delta G Lassa VPC vaccine. What it does is use a harmless vesicular stomatitis virus to safely present a Lassa protein to the human immune system, essentially training it to fight off the real threat. It's brilliant science.
And the urgency for getting these vaccines across the finish line cannot be overstated. Research suggests that up to 600 million people could be at risk of Lassa fever by 2050. Why? Because a changing climate is expanding the ecological niche of that multi-mammal rat. Combine that with the increased movement and migration of people, and the virus's geographic footprint is growing at an alarming rate. As the environment shifts and this rodent's territory expands, Lassa fever is no longer just a regional West African threat. It's a top priority global health concern. The medical detectives have mapped the virus, we know its methods, but the race is officially on. Will our global vaccine initiatives outpace this expanding risk zone before the next major outbreak strikes? It's something we all need to be paying attention to. Thank you so much for joining me for this explainer. Keep questioning, keep learning, and I'll catch you next time.